And welcome in, everybody. This is Pucks from the Pine Tree Pod. I'm your host, Benjamin Kennedy. Thank you so much for joining us today. Today, guys, I am very excited to welcome in Dr. Kristen Moody from Summit Chiropractic out of Bath, Maine. She's been kind enough to take some time out of her busy schedule just to discuss some health and safety tips for our school age athletes. Of course, we're in the end of summer now, and kiddo's going to be going back to school, starting those fall sports. So, Kristen, welcome in. Thanks for being here.
Thank you for having me.
Of course, my pleasure. So, before we dive into all the stuff, how's your summer going?
Amazing. Obviously, we actually get a summer this year because of the sun, and I don't know who the followers are. Are they from New England? Probably primarily, but I mean, all the rain last year, we really lost out, and now we kind of have this gift of a summer where it's almost all sun, and we came off of like a 3 or 4 day rain streak where we're like, ooh, but it seems we're back now.
We are, yeah. As you know, I'm in the paint industry as well, and so last
Hmm.
summer we were struggling. This year, it's been a much different game for us. So, yeah,
Totally,
a
totally.
little bit of sunshine goes a long way. So, no,
Totally, especially up here in Maine.
yeah, yeah. I mean, we get so little of it. 3 or 4 weeks of actual nice weather, and last year was such a disaster. So, um,
It really was. It affected everyone so bad. I mean, I see the repercussions of last summer still like apparent to this day. So
mhm.
the post-traumatic issues of like not having enough vitamin D or not being able to go outside and do a lot of outdoorsy things. So
Yeah, I mean
it's a thing.
that can really affect people. I kind of forget about
Hmm.
that, but you talk a lot about
Yeah.
that. I know, like in February when it's been winter for so long, people just kind of get into those depressive type of
Yeah,
modes, right?
seasonal affective. It's a real
Yeah,
thing out here. It's pretty
yeah.
it's pretty apparent. And again, especially in Maine, we never get enough sun, we never get enough vitamin D. So no matter what, even in our sunniest of summers, it sometimes is still not enough.
Hmm. Well, more sun is good. More sun is
Absolutely.
good. So, any big plans coming up for you this year?
Um,
Anything on your calendar?
I'm getting married in October, so
Oh,
that'll
are
be
you?
great.
Oh,
Yeah.
congrats. Very
Yay.
good. Well
Yeah, thank
done.
you.
No, that's awesome,
Uh,
guys. Happy for you.
yeah. Oh yeah, it's gonna be great. We're going up to northern Maine in a nice beautiful barn and small wedding, but other than that, we don't have anything crazy on the calendar, but in the future hopefully just some traveling.
Awesome. Awesome. Love it. Love it. Congrats to you both.
Absolutely. Thank you so much.
Sure. So we'll dive into some of these questions here. Just for our listeners,
Sure.
just give them a little bit of your background, like just your journey in
Sure.
becoming a chiropractor. Like what was it that
Mhm.
inspired you to become a chiropractor? Was this something like you were 10 years old and you said, I just want to be a chiropractor, or was there someone in your life that inspired you to go down this road?
Uh, I wish I had that, like, in my mind, I wish I had that, like, as a 5-year-old. I'm like, this is what I wanted to do the rest of my life. I really do. But I actually don't have that story. I started my bachelor's in animal sciences to become a
Oh,
large animal vet.
interesting.
Um, I went into the field. I got halfway through my bachelor's degree in that, and I ended up switching. I got pressured out of the costs of medical school because I had to, you had to go to med school. So I got pressured out of that, and I switched my career to kinesiology, sports education, and exercise science. I was a bodybuilder and a powerlifter at the time, kind of a hybrid of both, and I just loved it. And that's what made sense. So with that degree, I wasn't even thinking chiropractic until I hit the end of my senior year, where we have to do like an internship or say to complete hours, or you can write this monstrous paper. And I was like, ugh, I'm not into that. So I started interviewing physical therapists, occupational therapists, chiropractors to see where I wanted to go. And I went to PT for a little while, and I was like, I don't know. And then I went to this chiropractor, and he took me in immediately. He's like, yeah, come do your, internship here. Like, try it out. If you really want to, we'll take you. So I spent one day with him. And within the first 5 minutes, he had my hands on people, feeling things, feeling spine, feeling muscles.
Yeah.
At the time, I was like, oh my God, I don't know. Feeling the back of hips like glutes. I was like,
Yeah.
moving things around. And I was like, whoa, this is kind of cool. It kind of makes sense. And I watched him throughout the day and how he kind of progressed. And he had people like limping in, coming in tears, like, just all various levels of pain from, acute injuries all the way up to like maintenance, and people anywhere from like teens to geriatrics, like 90-year-old ladies coming in. And so the end of the day went really well. And then he brought me downstairs, like, hey, I want to show you something. And he showed me his collection of canes.
Oh,
Like
wow.
canes. So I was like, well, it didn't click to me, but I was like, what are these? And he's like, these are the canes that people have limped in with, and we've treated them, and they've left them here because they don't need them anymore. They donated them. And I'm like, oh, I want it.
Awesome.
I mean, it just makes sense to me. I'm like, if people are coming in pain or in dysfunction, and then they are leaving functioning better and having better off lives, like, why would you not want to do something like this?
That's awesome. That's awesome. Well, and quite a
Yeah.
visual too, I'm sure.
Oh yeah, huge, very powerful. And actually my first cane story just happened to me this past few weeks. So I actually had my first one, which I'm like so happy about. What a gift to have. But that, I mean, Dr. Steve is what really spurred me into being like, there's something to this. This makes sense. People are truly healing from this, and they don't need surgery, and half the time it's prevent surgery, and they don't need medications. And it's a really nice way to help yourself be functional without having to do a lot of like deep hospital or deep medical intervention. It just made sense. So forget medical school costs. I just went into it, and then here we go. The rest is history.
Awesome. That's awesome. That's awesome. I don't think I knew that background about you being in like the animal world. I don't think I knew that about you. That's awesome.
I really want to be an animal chiropractor actually one day, but in the state of Maine, you have to be a vet. So the rules are kind of funky, which is interesting because vets don't know how to manipulate. So it's just an interesting thing. We might be able to vote on it, change the legislation, change the laws so chiropractors can do animals as well, but we'll see. That's future.
I've never thought about bringing my cat to a chiropractor. This is the first and only time I've ever thought about that. That's awesome.
Horses are huge, and dogs. Dogs are really big ones too. A lot of people will take care of their dogs with massage, acupuncture, and chiropractic care. And there only happens to be a couple chiropractors in the state of Maine, at least, that do it. It's very interesting.
Yeah, that's a whole different world I hadn't thought about. That's cool.
Totally.
Cool. So, in my travels, I run into people all the time that think, chiropractic care isn't necessary, or it's just like a quick, go get your back cracked exercise type of thing. So you don't have to sell me on the idea of it, obviously, but sell the idea, and you kind of did already a little bit, but why that perception just isn't true, and kind of like the big picture macro level benefits of kind of consistent chiropractic care.
Totally. So I like to start with telling people you don't have to see like I guess the common stipulation is you have to see a chiropractor forever. Like you have to go all the time. You have to see it for, get adjusted constantly every couple of weeks or week or whatever. And that's the simple answer. It's not really true. It's just more along the lines of you're going to want to because it helps, and it helps you function. So on 1,000-foot view of looking at what chiropractic is not moving bones, but it's restoring motion to your spine, to your joints, to the surrounding tissues, and as much as you can, lack of better term, but to the connective tissue like your ligaments, and creating space so they can glide smoothly. So basically restoring function to the body, stimulating the nervous system, your brain, to hold that function through repetition. So if you come in, you've never been adjusted before, you're an acute injury, or you've had pain for the last decade, chances are one visit is not going to change 10 years of deranged tissue, of functional dysfunction, all sorts of other things going on. It just takes a little bit of repetition, a little bit of time to rewire your brain to say, hey, I need to move in a certain way, which is where I come in. We get you moving a certain way. And then your brain's like, oh, I want to go back immediately to how it was before because that's what I'm used to. So you have to go in again and be like, no, we need to move this way. And then you get better, and time goes on, and your body gets better and gets better. And then your visits get farther and farther between. And then we hit what's called a maintenance threshold. Once you're out of that acute kind of pain, or things are feeling better to your maximum medical improvement, we hit this threshold to where the stresses of daily life are going to overwhelm what your body can hold. So these stresses of daily life kind of overwhelm, and then you start feeling bad again. For some people, that can be a couple weeks. For some other people, that can be 3 to 4 months. It could be, or even longer, a couple of years. It truly depends on your level of activity, your day-to-day stresses, anything. I have people who come see me monthly. I also have people who come see me when they need it, and I don't see them for a year and a half, and they're like, oh, I did it again. And I'm like, okay. And, a visit or two, and then they're back up to functioning. They're feeling great, and that's fine. That's what they want. So on a macro level, that's kind of what chiropractic is. Yeah. It's a really broad spectrum of a profession, but at least that's what my beliefs are. That's what my research is based off of, because I'm a very evidence-based chiropractor. I like to have something that says, this has been studied, this is what we do, and this is why. So that's truly what I think chiropractic is.
Yeah, that's a great explanation. And I know when I started initially going to chiropractic care, it was for plantar fasciitis in my feet. And again, I would have never thought about going to a chiropractor for that until the idea came to me. And
yeah.
I mean, I just remember the first couple of times, breaking that down. I was flat on my belly, my feet strapped down, and this, I don't know, like this plastic little tool from hell, basically.
Yeah.
That
a gua sha or Graston, yeah.
Scraping across my foot. It's like it hurt and tickled all at the same time. It was the most bizarre feeling. But after like 3 or 4 months of that, I had suffered with plantar fasciitis for like 2 or 3 years, walking on concrete floors every day, and at the big stores. And then within like 3 months, it was gone, and it's stayed gone. So I became a believer in chiropractic care from that moment on. So.
That's interesting, because I get a lot of people who come in and they're like, my wrist hurts, but that's nothing you can do. And I'm like, oh, no, give me that.
I've done that to you.
That's one of my specialties is I'm an extremity specialist. I went with a lot of extra training so I could handle wrists, fingers. I mean, any joint from tips of your fingers all the way up to your shoulder, and then the creases of your hips all the way down. I know how to move it. I know how to adjust it. That's what I really enjoy doing, because that's such a crucial part of the rest of your body. I mean, your spine is the most important thing. Don't get me wrong. But if you have plantar fasciitis, chances are you probably got compensation up in your lower back. If you don't know how to take care of that foot, addressing the muscle, addressing the bones, your low back pain is probably not going to get taken care of either.
That's a very good point. Yeah, we're all interconnected, aren't we?
Totally. And I mean, from our toes all the way to our head, there's fascial planes that drive every motion that we do all day.
That's great. When it comes to like talking about school-aged athletes, what are some of the more common injuries you see that are walking through your door on a more of a daily basis?
The most common is the classic ankle roll. I really do. I've educated my patients a lot, because I get moms who come see me and they're like, my kid rolled his ankle last week in soccer. He's still kind of limping. And I'm like, maybe you should get that checked out. Like, bring him in. Let's see. And they're like, it's just an ankle roll. It's no big deal. We'll just brace it. And I'm like, well, if he rolled his ankle, he might have torn some tissues, strained those ligaments, micro tear, or all the way to a full tear. You don't know. Not to mention that if you're gimping around on that ankle, your knee is going to take some extra stresses. Your calf is going to take stresses. The intrinsic muscles of your foot is going to be a little bit more stressful. And those muscles itself are going to shut down in response to the swelling and the pain. So if you can get those bones of the ankle moving and release some of the swelling and get some of the fluid out, as well as supportive taping and a little bit of rehab, that kid's going to heal a lot quicker. His tissue is probably not going to be deranged as he goes throughout his athletic career, and he's got a better fighting chance, per se, for the future. And essentially, the number one cause of injury is a prior injury. So you roll your ankle once, now those tissues are never going to be the same. So we need to have them taken care of and given them the best fighting chance possible, so it doesn't happen again, or it doesn't get as severe in the future. I would say ankle-wise is the most common, but the most shocking is undiagnosed scoliosis in kids that they have no idea that's going on. I get a lot of athletes that come in, they're in a lot of pain, they like tailbone pain, like sacrum pain or something like that, or middle back and neck. like their soccer or whatever, they headed a ball and something doesn't feel right, like the base of their neck or something. And I'm like, oh, you've got a really significant curve in your spine, which is, for those who don't know, scoliosis is not a curve front to back. It's a curve side to side. So kind of like you have a high shoulder like this, and then your lower back compensates the opposite way.
Gotcha.
I see that a lot, and that changes the whole functionality of an athlete, how they run, how they kick, how they move.
That would be shocking news to go in as a 16 or 17-year-old and find that out. I'm sure.
Absolutely.
Yeah, that's a little bit bizarre.
Right.
And I know you talked about like the overcompensation. We talked about that a lot in my past in baseball. Where the UCL tear is such a big thing in baseball today, and a lot of it's overcompensation. Where if your knee's bad, your arm angles, how you move your upper body is going to be so different.
Yeah.
I've got a physical therapist that I still on good terms with, Dr. Kevin McGovern, who specializes in the UCL, like it's his baby. And it's amazing. I've been in his facility. I think he's down in Acton, Massachusetts. I think that's the town. And he can take a picture and within like 10 minutes change like 2 or 3 of his body movements. And all of a sudden his arm angle isn't way behind. He's more in line. And I mean, he's had a UCL tear, he says, for like 20 years. He's never had it fixed because he figured out how to move his body differently. So, yeah, definitely. Like my eyes were open that day.
Yeah, I mean, chiropractic and physical therapy either love each other or the practitioners clash heads. But I'm one of those people that's very pro physical therapy. There's a place for chiropractic, there's a place for physical therapy. And these niche physical therapists are absolutely astounding. To like spend all your time in learning just about the components of like elbows and that UCL injury that we commonly see is just, it's needed too. It's just fascinating, but it's very highly demanding.
Yeah, indeed. I know, and we'll get back to the hockey side here in a moment, but there was an epidemic too a while back where they were recommending kids just go and get the Tommy John surgery before tearing their UCL, like go under the neck before, because they're just assuming it's going to happen. So let's just go get it fixed. Like, how backwards away is that, in terms of thinking, about the body?
It truly is. What happened to preventative medicine first and supporting the body prior? And then if you do sustain an injury, trying to rehab it without cutting in and deranging those tissues further, and invading the body, and it reacts to that by laying down more scar tissue, more dysfunction, more compensation up the kinetic chain into the shoulder, etc. And granted, there is definitely a time and place for surgery. Absolutely. There is, but you always want to try the least invasive first.
Absolutely. So let's put ourselves in a position of, we've got a child that's an athlete aspiring to play collegiately or maybe even beyond. Is it better on the body? I know we're talking big picture here. Everybody's body is different, but would it be better for that athlete to play multiple sports or stick to that one and only sport? We know how demanding it is. I mean, hockey, these kids play year round. They're on travel teams, school teams, that they live, breathe, eat, sleep hockey. And that's what you got to do to get that, scholarship sometimes. But what's better from a body, from a development perspective, in your opinion?
I do have a large slew of hockey players, all the way from, even age 5.
Oh, wow.
All the way up to like college age kids and even adults who still play hockey. So I do get a wide spectrum. And I do see kids that play strictly only hockey and kids who like hockey, wrestle, and baseball, per se. I see better, more athleticism, not necessarily less injury, but more athleticism for the kids who play multiple sports at the younger years. They tend to be more rounded, again, more athletic, and they just perform a little bit better. And then as they develop and grow, then they start to specialize and narrow down. So instead of doing 3 sports, like you said, in high school, maybe they'll do the travel team all year round and then do high school level hockey. But I think having that like nice spectrum of different movements, different learning styles, different techniques, like kicking a soccer ball is not hitting a hockey puck. Throwing a baseball is not shooting a basketball. Like,
Right.
they're all very different skills, and the more well-rounded you can be as an athlete, the more it sets you up to kind of focalize as you get older. So the answer is kind of yes.
Gotcha. Yeah, I mean, like I've got my 4-year-old, and of course, he just did his first t-ball this year. But
Yep.
so kind of what you're saying is for those younger kids, get them into everything. Have them try
Yes.
basketball, soccer, hockey,
Everything.
baseball, whatever. Yeah. No, and I've heard that before. To your point, just
Yeah.
those sports use different muscles, different parts of your body, and
Totally. Skating on ice is not running. Like, it's not at all. Running is amazing. What I will say, the saving grace at the collegiate level is these guys are not just playing hockey. They're in the powerlifting gym. They're running. They're training other ways to be athletic. And they're usually doing like plyometrics, calisthenics as well, besides just skating hockey and tightening their hamstrings. So we do see a lot more well-rounded training. Those sports coaches are absolutely super knowledgeable, super fantastic. But yeah, as a kid, like a 4 or 5-year-old, get them in everything. Put them in t-ball, get them in basketball, get them running around, put them in a capture the flag league, whatever. Just get them well-rounded, get them using their arms and their legs in some type of coordinated motion at some point throughout the year.
Yeah, that's awesome. Yeah. And of course, with a 4-year-old, energy is not a problem. So it just kind of, sometimes I just open the door, just run around the house a few times before bed, just get it out of your system, right?
Right. You do some push-ups, do a couple laps, couple cartwheels, and go.
Exactly. Yeah, it was so much fun this year. We did. It was like the pre-T-ball here in Cumberland, and in the Cumberland Commons area. And first, this older guy that was running the whole program, and he was, kind of a jokester and a little bit of a comedian. He did such a great job with the little kids. But the first day, he had them all sitting on the grass, and this little girl picks a flower out of the grass and goes and hands it to the coach.
Yeah.
And then, of course, because she did it, and it was really cute, and we were all like, "Oh, that was really sweet." And then every single child followed suit, and like he couldn't even get to what he wanted to talk about because all these kids were bringing, flowers to him.
It's just got a bundle of flowers going. Oh, that's so cute.
It's very cute and hilarious. But at the end, it's like, all right, kids, he's got enough flowers. Let's get back.
Let's reel it back in.
Exactly. A little bit more of maybe a sensitive topic here, especially when you get into high school and maybe some of the college stuff where it gets a little more serious. Winning and losing, there's jobs on the line or whatever, but it's still like even at the high school level, it's just high school basketball or just high school, football or whatever. But before I get to this question, I still remember to this day, my grandmother, who's been gone now for quite some time, but going to my sister's freshman basketball games at Madomic Valley. And of course, it's freshman basketball. It's a pretty good sized gym, and there's maybe 50 people watching the game.
Sure.
And my grandmother, the language coming out of her mouth and the abuse to the official. I mean, here's this little old lady grandma just cussing up a storm. And I mean, she almost got kicked out a couple times. Like the coaches had to be like, Mrs. Kennedy,
chill out, Susan.
You're gonna leave. And my poor sister just, beat red in the face the whole time. But we know that there's some angst with parents versus coaches, or of course parents versus referees or whatnot. But what should a parent do in a situation where they feel like a coach is maybe improperly teaching their child like risky body movements or methods for the sake of winning? And doing it in a way that doesn't seem like being that overly aggressive, controlling type parent. Because I think some parents I would worry about that too, not wanting to step on toes, but being an advocate for your child too.
Totally. Oh man, what a question. It's not only one controversial, like you said, but it's an extremely heated topic. I coached a travel team basketball this past year, and parents are very protective of their kids, which is, I totally understand. Basically, so I'm not a parent, but again, I'm on the coaching side of things, but I can see both because basketball was my sport. I played every sport, but basketball is my main one. So coaching it has been kind of fun. And we have a very tough parent base where we were coaching.
Mm-hmm.
So, but what I made sure to do was, as a coach, communicate with the parents, like during practices, what we're doing and why. And if there's an incident, make sure the coach has proper communication. So if you're a parent, let's flip sides. If you're a parent and you think that your coach is doing something risky, I would gently reach out to the coach and be like, hey, let's say your kiddo was, I don't know, trying to do a dunk off of a trampoline or do something silly like that. Or
Right.
for hockey, like skating really fast down and then not being able to stop for the boards because they don't have the skill to do that quite yet. And they get hurt. Or, you can use that injury or that potential hurt as a way to bridge the gap and be like, hey, coach, my kid got hurt. This is what's happening. I'm not sure if this is quite the right technique. Is there anything we can do to, one, make this more safe? Or side note, if the coach is like, side note, sit at the practice.
Mm.
I have parents sit at the practice, and the coach may not think that's a lot of pressure, but that's pressure.
Mm-hmm.
That's pressure on them to be like, to do the right thing. And truly, if you think it's an unsafe thing, ask a local doc. Like, I've had people, I had 2 cheer teams last year ask me to come in and teach them safe stretches, safe warm-ups.
Oh, nice.
Do I know anything about cheerleading? I mean, I know the injury side because I treat that side, but the mechanics, I had to learn the impact related things. I had to learn the best dynamic warm-ups for them. And then I had to learn the specification of their routine so I can make sure they're warming up properly and then teach them that warm-up over the course of 5-10 minutes. So you could always ask like a local physical therapist, a local chiropractor to come in and be like, hey, could you come watch the practice? Or, hey, could you come in and see if this mechanism of play is good or the way they're training them is safe? If not, would you be willing to reach out to the coach and offer them maybe like a free session, or parents will pay someone? I mean, I'd do it for free because I think it's supporting the community.
Oh, absolutely.
But bringing a professional in is another way to kind of reach into the coach's pocket and be like, hey, I don't think what you're doing is right and safe. And granted, I may not be a professional, but my kid keeps getting injured. I'm worried, without having to pull your kid from the sport, because that's really tough.
Yeah.
And I've seen it too, where kids have had to get pulled from politics, and that's not fair to the kid.
No,
not
at all.
So those would be my biggest suggestions. Yeah, see, and it does happen. Honestly, it probably happens in every single school, high school, middle school, sport. Yeah, my dad was one of those stand-up screaming guys, respectfully. He wasn't swearing, but he got so excited. And whenever I got injured, because I was always a small girl, got like thrown around a lot. And if I didn't get off the ground, he would be pushing the refs aside to get to me to make sure I was good. So, so I get the parent protection, like protect your kids. And if you think something's wrong, speak up about it. Some coaches are super receptive, some aren't. But the only way to start is to just say something. Mm-hmm. If they are really not receptive, try and bring in a professional, because that'll be a nice little wake-up call for them.
Yeah, and I think too, another note here is that because there is such a shortage of coaches and of referees for that matter in all sports, and we're seeing it, get worse and worse every year. A lot of these coaches are volunteers. They might be parents of children.
They are.
We see that a lot often, and they're probably trying to do the right thing. But because they may be, not that expert on that sport, you may end up seeing this. And so, hopefully, if parents can, are going to do that, do it respectfully and
yes, absolutely.
Hopefully you get a warmer response. And I love the idea of bringing someone like you in. If I'm a coach, I don't know all the stretches. I mean, What a great resource it would be to have someone like yourself go in and teach a team how to warm up, how to prepare.
Absolutely.
Yeah, that's awesome.
Yeah, reaching out to those external resources, it would diffuse the situation first off, but also the coach who is maybe it's a dad or a volunteer who's just filling the hole. They don't know necessarily. They're like, I want you to shoot the ball and, or hit the puck. And it's like, that's all they know.
Yeah.
The coach might learn something. The players are going to learn a lot typically, because that's what they're there to do. And the overall level of safety increases. So, but yeah, parents, stand up for your kids. Coaches should be receptive to receiving criticism because they're the coach to teach, but they should be willing to learn and kind of mold to the position that they need to be in, on a safe level. Push your athletes though. Granted, push your athletes, but do it in a progressive, safe manner and in conjunction to the age that you're coaching too.
Awesome stuff. Um, we already talked a little bit about UCL tears a little while ago,
Yeah.
but another injury we often see is labrum tears, whether it be like
Yeah.
hip labrums or in the shoulder. What are some preventative things players can do to try to avoid those types of injuries?
Oh, yeah. I have a constant rotation of labrum strains, partial tears, even full tears that are non-surgical. Anywhere from, I don't see them below like 15 years old, thankfully.
That's
That's
good.
more on the UCL side, the overuse stuff.
Mhm.
But honestly, because it's funny, you get like a season of baseball and then sometimes you get 2 weeks of a break or like a month and a half of a break, then you have like another rotation going.
Yeah.
Or same thing with hockey, they get like a month off to like rest before travel starts up. My best word of advice for these athletes that are either starting a sport or they have a break in continuation or they keep getting injured at the start of every season is don't stop playing and don't stop training in between that break.
Gotcha.
Granted, you don't need to be skating out in the ice hard, but you need to be working on strengthening the supporting, well, if we go with the UCL, strengthening the support of this injury itself, which a UCL, for those, you probably talk about it a little bit, but that prevents, which is a valgus force of the elbow itself. So it's an external force moving the forearm this way. That UCL ligament holds this in place. And when you pitch, you overstretch this ligament, and then same thing with labrum, it stretches and stretches, and then you fling with your with your pitch, and it just causes a lot of added stresses.
Yeah.
So you need to support below and strengthen this area to stabilize your elbow itself. And then you need to support above. So that includes your biceps, your triceps, your brachialis muscle, your brachioradialis, your deltoid, all of your rotator cuff. So in between, if you're not playing active sports, you need to be doing like light load work on focused, slow and controlled motions with light weights, such as we do a lot of external rotation work that's nice and slow and controlled to stabilize the back of the shoulder, to again prevent any further excessive stresses on the front of the shoulder into the labrum itself. Similar or simple exercises like that go a long ways that when you go into the start of your season, it's not like a shock to your body. Even taking a month off can be a shock to your system. So do some,
go ahead.
Yeah, no, it's okay. Do some light pitching, do some light hockey work, like with your stick itself. Like just don't stop doing the motions and work on strengthening the stability around the most stressed out joints that you are going to be using. So yeah, hip labrum is another one as well. Less frequent, but this puppy right here, that's a big one.
Yeah,
It gets poured easy.
I think it was 2 years ago, Brad Marchand for the Bruins. I think he had a double labrum tear in his hip.
Yeah. Yes, he did.
He had a whole off season of just surgery and recovery. So,
It took so long to get. Yeah, I remember that too. That was really discouraging. But now look at him. He's back. He's doing well.
Still going, still cooking. So
yeah, honestly.
Couple more for you, and again, really appreciate your time today, Kristen.
Absolutely.
Oftentimes, you'll hear reports from pro athletes. You see this a lot in football, where an athlete might say, "I'd rather get a concussion than tear my ACL." Now, given all the awareness around concussions today and just the impact, what are some of your thoughts when you hear a statement like that?
I mean,
and it may not be. Concussions may not be a specialty for you, but I'm just curious.
No, I do. I treat a ton of concussions, and one thing I treat a lot of is undiagnosed post-concussive syndrome. So a concussion is where you have a rapid force and a stop of either your head or your brain or your neck. It's a whipping motion, and your head stops and your brain keeps going, and then it hits the inner wall of your skull and then kind of bounces back and reverberates. and it either, for lack of a better term, bruises your brain and the surrounding tissues and brings in a lot of fluid, breaks your skull, like cracks it, or causes a lot of contusions around like your facial area as well. Or the answer is yes, all the above.
Gotcha.
That neurological stress you undergo is still heavily researched to this day. We're still trying to figure out the exact mechanism of everything. But do you really, to the statement, do you really want to damage your brain, which keeps you alive and functioning, or tear a very successful surgery ligament, which is your ACL in your knee, which is your anterior cruciate ligament, which is, again, it's very successful repair rate. You can be back up and running. I've got an ACL tear that was 2 months ago, back up and playing predicted in the next 2 weeks. So you can give up 2 months of your life, or you can bruise your brain and potentially deal with repercussions, not just like 3 to 6 months down the road. I mean, a year or two with post-concussive syndrome. It's a long time if you're untreated and you keep stressing yourself and you keep doing these high-level exercises and you wonder why you're fatigued, you're getting migraines, you're feeling nauseous all the time. Like, athletes they get pushed a lot. And if it's not diagnosed and you're not realizing the severity of the symptoms with proper rest time and graded return to exercise, then you're just going to keep getting worse and you're not going to allow the damage that was done to heal. So I really think, I think that's a bullheaded statement for athletes who are like, I just want to play, I just want to play, I just want to play. Don't pull me out, put me in, coach. And reality is, protect your head, protect your nervous system.
100%.
If you tear your ACL, it's not fun, but it's repairable and it's rehabable. And concussions they're repairable, they're rehabable, but sometimes they take a lot longer and it's very unexpected. Sometimes you feel fine after a concussion and then a couple months later you get symptoms, or you didn't realize you're kind of been in a brain fog since then, and then you just go bad again.
Yeah.
So,
and I think too, like the NHL and the NFL in particular, they have spotters now. I mean, there's a lot more awareness around concussions. If you see a player like on the ice get hit and gets up and he's a little wobbly, he's getting pulled out of the game. And
immediately.
It's annoying when it's, third period, you're down a goal. It's like, yeah, we just lost our best player. But I mean, like you said, overall health and safety, I think there's just been a lot more awareness around it. So awesome.
Yeah, look at football. The entire league rules are changing. No below the waist hits you can't lead with your head. You can't hit. Well, in hockey, you can't hit from the back, and get that whipping motion of your neck is what they're trying to prevent. Check from the back.
Yeah.
There's a lot of regulations now surrounding, again, football, hockey, to prevent and protect your head, your neck, and again, your overall nervous system.
Absolutely. I'm not sure how familiar you are with this, but last year in the English Hockey League, there was a real major tragedy. Adam Johnson, former Pittsburgh Penguin American player, died on the ice, had the slit to the neck with a skate blade. There's been a lot of innovation with safety equipment. They're using a lot more of this like anti-cut or anti-tear materials for necks and wrists. And, the NHL they haven't really implemented it yet, but we're seeing more and more players, with the neck guards, with the wrist guards. We also had one 3 or 4 years ago, Nazem Kadri, wrist was on the ice and his wrist got slit. And he's only alive today because of the medical staff was there and they were on it.
Yes.
I guess the question around this, if you had a child and that child wanted to play hockey, given your expertise and what you do, would you allow them to play the game of hockey today?
My fiance played hockey his whole life, so it would be tough. Probably be, if I was a mom, I'd be a nervous mom in the stands, but I would allow my kid to play, and I would probably encourage it. And what I would do is I'd probably put my kid in hockey from as soon as he could stand up and skate. So he learns the skills, learns what to work around. But freak accidents like that are just one that was tragic. I saw the video and I was mortified. It is rough. Like I don't recommend people watching it if you don't have to. Don't watch that video. Just know it was bad. It was tragic. I can't even imagine. I mean, family was there, and other families are seeing that. But I would let my kid play. But being, a chiropractor and being knowledge, I would want to be involved. Parents like to be involved in their teams. I'd love to be involved and make sure things, again, are done well and protect your kid from the outside and the inside. And just start from an early age and keep your kid healthy and well-rounded. But I absolutely would. I think hockey is a fantastic sport. It's highly athletic. What amazing cardiovascular fitness it requires to do hockey. So impressive. These guys skate so hard, and they're just really true born athletes. So I'd be proud if my kid was a hockey player.
Great. Well, this is a hockey podcast, so I'm glad you said that.
Yeah. I know. Can I really say no? But
no, of course you can.
Honest opinion, yeah.
And just kind of wrapping up here, just kind of on
Sure.
a big picture scale, some like kind of do's and don'ts, like kind of
Sure.
for those young athletes. What are just some big picture do's and don'ts from an athletic or
Sure.
chiropractic perspective?
Eat a well-rounded diet. Like, if we're looking, are we talking college? Sorry, or kids,
Like
or
high school, college, yeah.
high school, college. I mean, the kids, anyways. Eat a well-rounded diet. I watched the football team at UMO, where I went to do my undergraduate degree. In the beginning, they were trained so hard that all they would do is pound McDonald's and Burger King. And by the end of the season, they were so overtrained, they're actually fatter, less healthy, and less athletic than they were starting the season through overstress, poor hydration, and poor diet. So eat a well-rounded diet. Just from the macro point, looking in, focus on protein, keeping your muscle built and strong. And hydration is another thing. It's super underestimated. Athletes need to be doing all their body weight, like, so say they weigh 150 pounds, in ounces per day minimum.
Okay.
The general population needs to be doing about half your body weight in ounces per day minimum. So 150 ounces, that's almost a gallon of water for an athlete that's training. That is not out of the ordinary. And a lot of more research says that number actually should be jacked up higher.
Gotcha.
Our body, 60, 70% water, we need to maintain that so your body can decrease all the lymphatic discharge from your muscles. It needs to be keeping your muscles nice and loose, feed your brain with that hydration, all of it. Your whole body needs it. Don't stop training in your between seasons. So I talked about this before, and it doesn't have to be the intensity of the normal season, but it needs to be light work. If you need to take a couple weeks off to rest and recover, I get it. You do need that. You absolutely, that is so crucial too, is to rest. But you do need to maintain your level of athleticism so you don't go into a shocked system when you start your season back up, or you start your next round of travel, et cetera, you're in between. Keep just, if you're running 5 miles a day, drop it down to 1 to 2, 3 or 4 times a week. Keep a mobility routine, get into the gym, strength train a couple times a week just to maintain your muscle mass. And you're going to be a stronger athlete starting off. You're going to feel better, and you're not going to be as shocked when you go into your season. Those are my biggest recommendations for sure that you should always start with. And that seems a little, but that's actually huge. I mean, a regular adult could take that into play. Stretching is important too. We're actually incorporating more stretching into high schools, which is great. They have yoga classes now. I don't know if anyone knows about that, but yeah, cross-country runners now 1 day a week, and I think track in the state of Maine have 1 day of just yoga, just stretching their muscles. Yeah, 45 to 50 minutes or so of training. So I think that's super cool, super important, because yoga doesn't train those big, strong muscles that we use to like lift with every day, but it trains your little stabilizing muscles, and it stretches everything out at the same time. It's a wonderful way to keep your body functioning and flowing and moving.
Awesome.
So yeah.
So last question for you. Of course, I have your website running down below, but tell the people where they can find you, and are you accepting new patients at this point?
Yes. Okay. I'm in Bath. I'm right in downtown Bath, Maine. You can search me right on Google. Super easy. It's Summit Chiropractic. I run my office by myself. It's just me. I don't have staff, so I'm okay with saying that on, publicly. I do accept new patients. I take athletes all the time. I have people who travel 2 to 3 hours away to come see me from above Bangor. I get wrestlers. I've got 2 wrestlers right now that travel the country, and one was the top wrestler in the state this past season. It's kind of a lot of fun to treat these high-level athletes and keep them going. The only kicker for some people is I don't take insurance. I do a fee-based system, but with insurance trending down, a lot of parents are saying it's worth the investment to keep their kids and families healthy. So yeah, so find me there and reach out if you have any questions too. I always love taking questions and helping direct people if they don't know where to go or if they're looking for someone in a certain area. Sometimes I might be able to help you find someone who's athletic based or really takes their time with their patients. And I think that's really important, is spending as much time as you can working on your patients itself.
Mhm. And I can speak from experience. You do a great job with that, very thorough, and I've always appreciated your expertise and my time as your patient. So
I
that's
appreciate that, Ben.
oh, of course, of course. So go check her out, guys. It's summitchiropracticmaine.com. They're on Center Street in Bath. Kristen, thank you so much for taking this time. This has
Thank
been a
you.
real treat.
Oh, this is so much fun. I love doing this. So anytime, Ben, I'm willing to come back whenever you need me.
Yeah, down the road, maybe we do this again. Of course, I'm starting my
Mm.
Mariners hockey report for Black and
Oh,
Gold
yay.
Productions coming up here real soon. So maybe as we get
Congrats.
into the, oh, thank you. Once we maybe get into the hockey season, maybe we can turn into maybe more hockey specific kind of stuff. But
Yes.
awesome. So thank you again so much, guys. Go check out her website. And again, just thank you all for listening. And until next time, be kind, show love, and God bless.